In today's Insight, an issue that can mean life or death for children and teenagers around the world. It's adolescent pregnancy. 1 in 10 of all pregnancies occur when the mother is between the age of 10 and 19. And when that happens, the risk of death or complication dramatically increases. First, some facts from the World Health Organization. It says every year, some 16 million girls between the ages of 15 and 19 give birth. Virtually all of those, or about 95%, occur in low and middle income countries. Of all births that take place during adolescence, about 2% occur in China. More than half, or more than 8 million, occur every year in sub-Saharan Africa, and 18%, or about 1 in 5, occur in Latin America and the Caribbean. CCTV's John Holman explores the issue from Mexico.
Health worker Rosario is making her rounds in San Javier Jojo, southwest Mexico. Next stop, sisters Karen and Dulce. Karen had her first son when she was 15. Now Dulce is expecting at the same age and is feeling apprehensive.
Sometimes I think I was in too much of a hurry because I see the situation my sister is in, and I think she suffered so much when she was younger.
In Mexico, 17% of children are born to mothers from 10 to 19 years old. The country has the highest teenage pregnancy rate in the OECD, the Organization for Economic Cooperation and Development. In many families, socially conservative values, coupled with a deeply Catholic outlook, make family planning a taboo subject.
I think people here, girls' moms, are very traditional, so they don't talk to their daughters about contraceptives.
Which means that many girls don't know about or are afraid to ask for the condoms Rosario sells at low cost. Government surveys show nearly 2/3 of teenage girls don't use birth control the first time they have sex.
Many young girls say my period didn't come, and when I realized I was already pregnant. So now I'll have it. But I wanted to study, I wanted to have a career, but now I can't. And later they have too little financial support to keep studying because having a child is costly.
A cycle that in many cases leads to fewer opportunities, not only for the young mother, but also her child. Down the road in San Javier Jojo's secondary school, reproductive health organisation MexFam are trying to keep girls in school through a crash course in sexual education. But for many living in the Mexican countryside, where teenage pregnancy rates are highest, secondary school is not even an option. Many small rural communities like this one only have a primary school. After that, opportunities are limited for girls. Many are simply expected to abandon their education, marry, and have children. In some isolated indigenous villages, it's not uncommon for girls to be married by 13.
If by 15 or 16 she's not married, well, maybe she'll get left behind. That's the mentality.
Children inevitably follow, unless they take the contraceptives handed out by community nurses like Angelina. She often doles them out in secret to women frightened of their husbands in this male-dominated society.
Women here are very submissive to men. The man says, you do this, they do it. You don't do this, they don't do it. And it's the same for family planning. Sometimes women want it, but the men don't. And they say, you won't use contraception because you're my wife. You have to bear the children I want.
Gender inequality and social taboos around sex mean that, especially in rural parts of the country, teenage pregnancy remains ingrained. But for Dulce, it's a new challenge, and one she can only hope she is ready for. John Holman, CCTV, San Javier Jojo.